So it was quite pioneering at the time, founded by my partner, Charles Levinson, who founded it basically because he thought that the way home visits were being done by GPs was inefficient. You would leave the surgery running and then you would take a couple of bags which were probably poorly prepared and go see a patient in their home. So he thought you could do it much more dedicated way. He started off doing it for other GP practices, and then we still do it for about 40 GP practices in London. So we do their out of hours and their home visits, so housebound patients and so on. That's the background. We actually do another service, which is the flu business, which is where we'd go and onto corporate sites and do flu and COVID vaccinations for large populations. And we pioneered that as well. But I'm going to talk more about the first service. And we are a high fidelity service. We're a high fidelity service, right? So, and to give you a sense of how we work, and we work 24/7, and we look at how we answer calls, how quick we answer them, when we answer them. We look at how fast we get to the patient. Generally, the area I want to talk about is healthcare clients. So in addition to the big names which I put on there, you'll see the Basuto practice and Sloane Street practice, which are one of the 40 practices we serve. And the way we serve them is a range of services, but effectively it's home visits and accessible care for the homebound. So 24/7, out of hours cover, and accessible care for people who are housebound. We got various technological capabilities, like when our doctor finishes the appointment, the report is automatically sent to the home GP, right? So the GP can then can handle it. We take personalized patient instructions, and I'll show you a case of how we do that. We can either charge the patient or charge the practice. So often the practice wants to be charged when they have a more memberships on, and they'll go, we will give you 24/7 cover, and we will do the 24/7, and so we will charge the practice. The practice probably charges a membership fee to their client or to that patient. And for our contracted clients, we give a guaranteed service, a dedicated phone number, and co-branding available. So we can and we do answer the phone on behalf of other practices. We go Doctorcall on behalf of. We won't do white label, so we won't say we are the Hilton Olympia practice, but we will say Doctorcall on behalf of Hilton Olympia practice. And we have non-compete approach because we don't have a physical clinic, and we don't want to get into physical clinics. So we sold our physical clinics to focus on this, to actually not compete with our partners. So I think that's our sort of nuts and bolts, but our ingredients. But the way that comes together is probably a couple of examples, and let me introduce you to Mr. BX. Both of these examples I'm going to go through happened in the last 2 weeks as I was going through our sort of partner cases. These came up. So Mr. BX has metastatic prostate cancer, which is managed at home by his private GP. And, he called us on a Saturday afternoon seeking guidance because he's in significant additional pain, which is beyond what his meds were capable of coping with. So he is a retired city financier, is comfortable with computers but prefers the phone, and he phoned us and he was able to get through. So what would have happened to that patient on the weekend, on a Saturday, if we hadn't been available? He had phoned his practice because that's his first protocol, and he would have been worried: is something seriously wrong? Am I, do I need to be seen straight away? But he would have got an answer machine and he would have left a voicemail. But as he was leaving it, he would have been thinking, what's my plan B? What am I going to do? Because it's not going to solve the issue. So in the end, he may have visited A&E because it's a safe protocol, and it would have been inconvenient and tiring, but better be safe than sorry, right? So that's what happens. On the Monday morning, the practice would have come in, heard the voicemail, and actually potentially called him back because they would have been worried about him as a patient. Mr. B accident, we need to call him back. But he would have said, I'm sorted, because he would be still in hospital, or he would be at home with a rearranged meds or whatever. I'm sorted. And in the back of his mind, he'd have been thinking, but no thanks to you as a practice. So we help a practice elevate that service, right? So what did we do? We answered the phone on Doctorcall on behalf of such and such a practice. Immediately on answering the phone, that's a relief, right? Because actually this practice diverts the phone to us. So out of ours, it diverts to us, and there's immediate relief. Then he gives us background and need for a visit. His details are already on. His patient details were already on our system, and that he had metastatic prostate cancer. So that sort of recognition gives him confidence that the service he expects. Our doctor went there quite quickly, adjusted the painkillers, assessed that he did not need to go into hospital, did not need any immediate further escalation, and the moment the doctor was finished, the report was sent to the practice. He would have been safety netted around if this happens, call us back. If this happens, call us back. But it would have gone back to the practice. We'd have held on to him till the practice opened. The practice opens on Monday, phones up the patient, and goes, "Look, you're here. I see the doctor's been to see you. They're suggesting a follow-up. Can we book you in?" And that is a delight. It's a delighted patient and a really good service. So that's what we enable the practice to do. We enable them to delight. The second, we also do pediatrics. So there's another case we had in the last 7 days. This was Miss FC and her mother who phoned. Mother is 41. The social history is 41. Is a city law partner. Is able to deal with the system. So she actually booked online. She called at 6 in the morning on Monday morning because her daughter has been a temperature, and she's reconciled to Monday having to work from home, but she's happy with that. But on Sunday night, overnight, she realizes it's not getting better, and the priority changes from being at home with the daughter to I need to get my daughter sorted out so that I can manage my work. I can give her, I can rearrange meetings and so on. So Monday 6 o'clock, she phones a practice. So what would have happened without her? She'd have visited the practice website on a mobile phone to see, okay, let me see if I can go to my private GP and see what happens. She navigates there, and the opening hours say it's closed, basically. And so then she goes for a plan B. And the plan B that she would want, and I'm surmising here, the plan B she would want is at that time of the morning, she wants to be able to book an appointment so she can rearrange a day. She knows that the child's probably not, it's not a serious issue, but she needs to sort it out. So she would have booked something, and she would have looked around to book somebody that she can get into, and then rearranged her meetings around that so she can take her daughter to that. In the end, she would have gone there and resolved it, whether it be NHS or private, she would have resolved it. Now, when the practice would have never known about it, but actually the result is that the practice has either lost her as a patient because she's now with another provider, or it hasn't been resolved perfectly well. She may have gone to NHS or something else, and she's not perfectly happy, but it doesn't reflect well on the practice. So that's the service we provide for practices, and it's for practices who want to wrap around their patients and make sure they keep the patients. So that's what we do. What actually happened? So effectively, the doctor went and visited before working hours, and it was an upper respiratory tract infection. They dispensed the medication then and there. The mother didn't have to go to the pharmacy to get it filled, the prescription filled, and the report was emailed to a practice, which then a follow-up call. And then it's now in the ecosystem of the practice. The practice knows what's happened, and actually they kept the patient there, and the patient is delighted. So those two scenarios are the core reasons why practices use us, right? Those two are the reasons.